Good morning. Chris Hull, Wake Forest Baptist Health, Infectious Diseases. So it's the second week of September, and we've been at COVID for a while now. I've even lost track how many weeks it's been. So as Garrison Keillor used to say, it's been a quiet week for COVID in the country. In a lot of the places that were having problems in the Midwest and in the South, cases have been declining slowly but surely. Some places they've plateaued, and even some of the states that more recently were having fairly exponential increases, it's leveled off some. So that's all good news, and like I say every week, as long as cases are declining, I'll take it. I'd like to see them go down faster, but we'll take it. Here in North Carolina, our cases are also still slowly decreasing. We did, if you look at the North Carolina COVID dashboard, have kind of a shoulder or a bump, because the cases were slowly coming down, and then there was a little bump on the side. And that bump is also now coming down to what the baseline was before. That bump comes from the college outbreaks, particularly at East Carolina, Chapel Hill, NC State, to some extent UNC Wilmington, and so those have kind of slowed themselves down a little bit. Here in the Triad, our case numbers also are slowly continuing to decline. Hospitalizations have declined not only in North Carolina but also in our area here. It's a slow decline, but again, at least they're not going up. We'll have to see how long this continues. My prediction, as long as we have a consistent use of masks and personal distancing, that we shouldn't see any increases in COVID cases in our area. Now, what could get in the way of that? A few things. One is it looks like that some of the counties and school districts that decided to push off having in-person classes may be coming back for having in-person classes for at least a portion of their students, maybe not all of them. And that might include Forsyth County, so we'll have to see how that goes. As I've talked about in the past, it's the school itself. It can be done safely, and transmission would and should be a rare event in a school. But there's other activities that go around school, including social activities for kids and athletics and such. So those are places that might be a little bit harder for us to do things that prevent transmission. So we'll have to see. The devil's in the details with that. The other thing that could get in the way of it is large events where people might get together. And you have to understand, even though the event itself could be done in a way that would seem safe, it may be that there's a lot of activities in and around that event where social gatherings could occur with large numbers of people, and transmission would occur then. So a few examples of what that might be. A football game. You could have the football game without fans, but if you have a lot of parties and football game watching events and all the things we like to do, tailgating and such, barbecues with it, those are areas where people can get together and transmission can occur. So if you're planning an event like that surrounding a football game, you need to really pay attention to that. And if it's in your home especially, put it outside. Figure out a way to get the TV out on the deck when the weather's nice. And if you're going to have friends over, watch it out there, and personally distant, and wear a mask when you can't. So it can be done. If you want to have a get-together, it's better to do it with people that you sort of potted up with and people you see and know real well, so you know what everyone's kind of social world is like, and so that you can do, when you merge your two bubbles, merge them wisely. So those are just things to think about for sporting events. So there could be other events too that might happen. We just had a large political rally here in Winston-Salem. According to some estimates, 7,000 to 9,000 people out at our airport. Now, if somebody would have said, is that a good idea? I would have said no. From a COVID standpoint, it's not a good idea. But the majority of the people who were there were not wearing masks, and really wasn't any personal distancing going. The only thing we have had going for us on it is that it was outside, and that helps a lot. Unfortunately, though, for that event, the parking was not anywhere near where the event occurred, and you had to get in a bus to go there, and the bus ride would have been 20 to 30 minutes with unmasked people, and probably a lot of large, loud voices, and you know how rallies go, a lot of yelling and loud talking, and that puts out more virus. So it turns out that event does have some potential for it to be a super spreader event. The being outside would decrease that chance, but being in buses would increase it. So, you know, we'll have to see. There were people from all over the place who came to that. So trying to keep track of how many cases actually would have occurred from a single event when the people spread out afterwards is a little hard, but time will tell. And if you were at that large event or others where there's a large group of people, you know, more than 50, more than 100, and people are unmasked and close together, the civic and responsibility would be to kind of self-monitor for 14 days, lay low, kind of put yourself in a self-quarantine situation. Either that, you could also get tested. If you're going to get tested after a large event like that, you would want to wait 4 or 5 days afterwards and then get tested, and to provide some peace of mind. But just realize that after, you know, being at an event where there's large groups of people and they're not masked and they're not distant, you have a risk, and you got to kind of be monitoring yourself to see if how you feel, and if you get sick, get tested for sure, and you can consider getting tested 4 to 5 days after the event. So these events will be occurring on and off throughout the fall, so we're just going to have to be careful of that. Each one of these has the potential to become a big problem. Doesn't mean it's going to happen. It means it has a potential to happen. Just remember the Biogen meeting up in Boston, probably 20,000 people across the world got that strain of virus from that one meeting. So these things can happen. A little bit also in the news, something to comment on, vaccines. So you know, we have about 10 good candidate vaccines that are going into phase 3 trials. What's a phase 3 trial is when we actually vaccinate large groups of people with either the vaccine or itself or a placebo, and then look to see if it's preventing infections in the vaccine arm compared to the placebo arm. So you do the statistics and say, hey, there's like 30% less infections in the vaccine arm, so it works. You'd like to see a number greater than 50% for that, by the way. And then you also look to see if the vaccine is safe. So a lot of these trials are going on. Some of them are about half done now. Having a little bit of trouble recruiting minorities and people from socially economically disadvantaged areas and different ethnic groups. You want to get as many different people from as many different areas into a trial as possible so that you can say it broadly works for the entire population. And so some of these trials are going to be finishing up probably sometime towards the end of October. Will we really have a vaccine by November? No. We're not going to have a vaccine that's ready and to go out by November. It doesn't mean we can't have wishful thinking for that, but the reality is no. It just takes time to do these, and you want to make sure you've done it right so that you know that the vaccine works and that it's safe. And I can tell you that if I think that there's been shortcuts done, I'm going to tell you. But I just don't see that coming out of science. And if you're going to be listening for reports about vaccines and how well they work and how safe they are, get it from your science people, get it from your public health people, and let's not get it from politicians or political appointees. Get it from the people who actually know. And so what about the Astrazeneca trial? So Astrazeneca is a company that partnered with Oxford in England to make a vaccine. And they've vaccinated quite a few people so far, somewhere around 10 to 15,000, I think. And they had one event in this group of people which involves some inflammation in the spinal cord in one person who had gotten the vaccine. And so the trial was halted because we need to stop and figure out whether that event actually happened with that vaccine. And so people understand that process. In any big clinical trial, you have something called the Data Safety Monitoring Board, DSMB. The Data and the Safety Monitoring Board is independent of the company that makes the vaccine or the people doing the trial. And it's their job to look for safety events. And so this is in any big trial where you have a vaccine or a drug, you have that. And so it's nothing new. We have DSMBs all the time and have had that for decades. And so the Data Safety Monitoring Board saw this event and said, well, let's figure out what this is, so we're going to stop and figure it out. Now, anytime you have a very rare event, like inflammation in the spinal cord, something called transverse myelitis, anytime you have a very rare event that occurs in a trial, sometimes you're left scratching your head because a sporadic rare event's going to happen sporadically in a trial or not. So it can be a little bit hard to know sometimes how that is. So, for instance, if you have 300,000 people get flu vaccine and one person gets meningitis, does that mean the flu vaccine caused that meningitis? No, it just means in that population you have that event. So these are the things that need to be thought about and looked at, and so I think it's actually a good thing that the DSMB found this event, and it should be encouraging to those people who think that the vaccines are being rushed and that the safety aspects of it is being rushed and not looked at, because this is how these things are supposed to happen, and it happened like it's supposed to. And so we'll have to see what happens with it. Now, all of the different candidate vaccines that are being tested are different. Some of them are live virus vaccines, some of them are what are called replication incompetent vaccines, which means they can't replicate in a person, but they can cause immunity. And then the majority of them are either messenger RNA, which is a genome component, or they're just protein with adjuvants. So the protein with adjuvants are the way we make almost all our vaccines, including tetanus shots and whooping cough shots and so on and so forth. Live virus vaccines that we get all the time are our measles shots, our mumps shots, and rubella shots. So all these vaccines are a little bit different. So if one of them has a safety question, it doesn't mean the other ones do. In fact, they're all so different it really doesn't apply to them. So it's just a little bit of background about what what the Astrazeneca vaccine safety event that happened. And we'll have to see. We don't, right now, I'll say I don't know whether it's related to the vaccine or not. I'd like to see the data once it's all worked out. With that, I'd like to move on to talking about Halloween, but do we want to have some questions first about non-Halloween topics, and then we can move into Halloween?
I do have one. You already addressed the trials and things. It's time of year when flu season starts and allergies ramp up. How do people know what could be COVID and what could be something as simple as an allergy to flu?
So what's COVID and what's flu and what's an allergy? Well, allergy is a little bit easier to sort out. Allergies don't really have fevers with them. Allergies are more nose and sinus irritations, stuffy noses and sneezing, watery eyes that can occur. So COVID and the flu usually have a fever, and they're more than just irritations of the eye, nose, and sinuses. They oftentimes have respiratory aspects to it. Flu hits pretty quickly. A lot of people who get flu know what time they got it. Hey, it was 4 o'clock last night. All of a sudden I felt horrible. Got a headache, bad muscle aches, and I had a fever. So it's very sudden onset, fever, headache, and muscle aches. The sore throat with flu is pretty minor. And then it goes on over 3 or 4 days, and a cough becomes pretty prominent with it. There's a lot of coughing with influenza. And the fever goes away over that 2 to 3 days. And in COVID has a lot more different signs and symptoms associated with it than flu. Like flu, it has a fever in most people. Like flu, it has a headache in most people and muscle aches. There's, I think, more fatigue with COVID than with flu, but it's a little bit hard to know from person to person. There's a little bit of diarrhea. 20 to 30% of people with COVID will have some diarrhea with it. It's usually not severe, but it can happen. And flu, that would be pretty uncommon, actually. The one thing that's really different with COVID than flu is the loss of sense of taste and smell. So if you got a loss of taste or smell, I'll start over. If you have a loss of taste or smell sensations, that is much more likely to be COVID. So there's a lot of overlap between flu and COVID, and the only way you're going to know 100% for sure is to get tested. And which I would say you should, because it's how we respond is different, right? So if you have COVID, you're in isolation for 10 days, and you can't go to work, can't go really out of your house. If you have flu, you really should stay home until just you've had no fever for 24 hours, and then you can go back to school or work. So it really makes a difference to know which one it is. And I think as time goes on, a lot of our primary care practices will have the ability to test for both using more rapid tests, kind of like how we test for strep throat and things like that. So it's a good question. And I think in a couple days we'll have on our website a nice chart for people to look up, Wake Forest Baptist Health. So that's in the works right now. So, any other questions? Oh, okay. So let's talk a little bit about Halloween. Can we have a safe Halloween? If you look at some media reports, it says, "Oh darn, we're not going to have Halloween this year. What a sad thing. It's all canceled. No Halloween." So I started thinking, really, why? There's a lot of things that Halloween's got going for it to be safe in times of COVID. One is that a lot of the activities are outside, and outside is a much safer place to be than inside. Two is that there's masks with Halloween. So if you're going to wear, a regular mask, like a Halloween mask with the holes for the eyes and the holes for the mouth, you need to wear another mask either behind it or in front of it, because those holes obviously don't stop anything from coming out. So you could kind of be a little bit imaginative and innovative. So what kind of cool masks could you use for Halloween and change it up a little bit? And I'm sure we'll see a lot of neat imagination with that. So that's going for Halloween. The other thing is that, for kids' activities, a lot of it's supervised by parents, and so you can make sure the kids are doing what they're supposed to do if you're going to have some activities outside. So there are some things, though, about Halloween that we are probably used to doing that we really don't want to do, and that's adult parties with large numbers of people in costumes in houses where there's a lot of crowding, and that's going to be something to stay away from. If you're going to have an adult party, do it outside, keep it small, all those things we usually talk about. Personally distance, mask. And then haunted houses may not be a good idea. Again, it's indoors. A lot of times it's dark, and so it's a little bit hard to know. So let's go through it. We asked for suggestions from people on things that could be done safely for Halloween. So Sandy says, remember, Halloween masks have holes for eyes and mouth. Wear the correct mask this year, please. And we talked about it. You got to make sure your nose and mouth are covered. And so holes don't contain anything. So if you got a mask with holes in it, you got to double up and use another mask with it. So Diane says, why is it any different than going shopping? Just keep your distance from other people. And that's true. So if you're trick-or-treating, if you have a family unit, a brother and a sister, they can obviously stay together while they do their trick-or-treating, but the other groups need to stay back and recognize the people. So it's the shopping cart phenomena. Imagine you're 6 feet between people if you're going to do it. And you also have to recognize that there may be a lot more households this year that'll just choose not to participate, so you have to be respectful of that. I think for those homes that want to do and have some trick-or-treating, it's probably nicer to set up outside, have a little table, or be out on the stoop or on the porch, rather than have the ring the doorbell phenomena. That way people will know a little bit more that you are involved, and then you can have some supervision on how the kids come up. And if you see 3 groups of kids all trying to run up and get up at the same time, you say, whoa, 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 okay, one at a time, and you can bring them up in order. So Enola says, children can dress up and their parents can drop candy into their bag every time they pass a neighbor's house. So you, the parent, have your own candy and you pass it out, right, into their bag as you go by a house. That way everyone gets to see everyone else's costume. You're outside walking around, but instead of actually going to the doorstep, you can drop the candy in the bag. Great idea. Can't be any safer than that. It's like going for a walk. So the kids can wave and greet everyone from a safe distance. Bonus, parents control the type and quantity of candy. That is a bonus. I would probably get the candy I like, but if doing this. All right, Melanie says, neighborhoods can set up a specific time for Halloween. A lot of neighborhoods do this already, so you can check with your HOA or your neighborhood group if one exists. Between those hours, adults can drive, walk, or ride a golf cart through the neighborhood and throw candy to kids in the yards. So the kids stay in the yards with their costumes on, and then the adults go around. So you kind of reverse how Halloween works. It's, as one other person here says, it's the Mardi Gras way, right? So the parade goes by, and the kids are there. So I think that's a great idea. You have to work that out with your neighborhood. That's if everyone wants to do it that way, so everyone's on the same page. Our neighborhood, Leslie says, is talking about doing what we did at Easter. We will have someone in a Jeep dress up and throw out candy kids in their driveways. So another vote for the Mardi Gras way. So there you can toss out the candy out there. Margaret says, have a neighborhood parade so you can keep social distance outside, but kids can wear costumes with a mask. And then you could have pre-made treat bags with candy for everyone. So there's another good idea. So you remember sometimes where we had Halloween parades when we were kids at school, and you do the parade in the classroom. Well, instead do it, in an area of your neighborhood and get all the kids to parade. And so they can show their costumes off, and you could have treat bags for everyone at the end. I think that's another great idea. Shannon goes with the Mardi Gras style. Kids stay in their yards, apartment parking lots. So apartments, are a little different, right? Because if you're going to be trick-or-treating at an apartment, you want to be out on the parking lot doing this and not in the hallways at the apartment. So Emily says self-serve candy bowls on the porch or set up a table outside to interact with neighbors if you must. Everyone waits their turn at a distance. If it rains, I guess you stay home and watch scary movies. Yeah, so, excuse me, a lot of good points here. A lot of these activities are outside, so if it's rainy, it's going to be hard to do most of these. So I guess watch scary movies. And if you have a self-serve candy bowl on the porch, though, you have to remember that if you have multiple hands going into the bowl, there is a potential for germ transmission because there's different people putting their hands in the same bowl. So it might be better to set them out individually and then for you to replace them. So, or to put them in a Ziploc bag if you want, or a treat bag, and then hand those out. Martha says trunk or treat method, prepackaged goodie bags, put gloves and masks on, adults hanging out, distanced, nobody reaching in with germy unwashed hands. So you just hand a treat bag. And then Laura says set up a candy graveyard with fake tombstones in your yard with prizes and candy piled up next to each tombstone. That sounds like fun. It's a little bit more work, you got to make tombstones, but that's pretty neat. So you could have each child enter the graveyard one at a time and package up candy and prizes in individual treat bags. So I had somebody actually mention to me something that's a little bit like that, and that's, I think, a neat idea, would be to have a kind of like a scavenger hunt in your neighborhood. So if you have a common area, a little park or place, you can hide candy and then have the kids go find it like Easter egg style. And put it in treat bags so you don't have a bunch of Jolly Ranchers hanging out for 2 weeks afterwards that don't get found. But so you could do it that way, and so there's a lot of ways that I think Halloween can be done safely, and I don't think we need to cancel it. And so I think we just need to think about how we're doing, coordinate with our neighbors in our neighborhoods, and so everyone's kind of doing it the same way. Some other things I thought about personally was if you're going to be handing out candy, use the tongs, like a salad tong, to do it, and then have the kid put the bag out, trick or treating, and then you drop it in with the tongs, so you're not actually touching it. And I kind of thought about, you can make a really long sleeve and have your tongs sticking out at the end, and you could make it part of your Halloween costume, right? And the tongy hand reaching out to put candy in. And so, I think anyway, again, innovation, and we want to try to keep from multiple touch surfaces. We want to keep people apart. We want to make sure masks are being used, crowding's not being done, and keep it outside. There's some other Halloween activities, too, that I think might be going on. Corn mazes. So I think if you can find a corn maze that's out there, corn mazes are always fun. And obviously, you're usually not all bunched up when you're doing it. So again, you just have to pay attention to detail with it. Can you do hay rides? Yeah, you could. Put a big bunch of bundles of hay in the middle of the wagon, and then have the people distant out a little bit on the wagon itself. You won't be able to haul around as many kids at one time, but you can still ride people around on a hayride. The other thing to remember is if you're a family unit, it's okay. So So if you got, a bunch of people who are on the same pod or in the same family, they can do the activities and be close together. So that's something else to think about. There are also some other things, the good old-fashioned, I guess they're old-fashioned ways that people used to have Halloween. And you can do them with your own family or within your own pod of people the fused bubble pod. And bobbing for apples, family game night, charades, but do it with, a scary Halloween style for charades instead. Our family, we play a variation of 20 questions at Halloween called Ghost in the Closet. You take somebody who's no longer alive that's famous, and then we do it in a closet, so the parent and a child, particularly for the young child, are in the closet, and they're the ghost, and then the people on the outside write questions down in turn on a piece of paper, slide them under the door, and then the child reads the question and then answers whether or not that is. So it's 20 questions, trying to find out who the dead famous person is. And it's kind of neat to do it with the writing, especially for younger kids, because it helps them with their reading and writing skills, and the parent can be there to help. So that's something that we've done. All of those traditional Halloween party games that you can do with your pod and your kids, and those can be done inside because you're potted up, and if it's rainy, you can still pull it off. So those are some ideas. Thanks to everybody for sending those in. I think there's a lot of great ideas in there, and so that we can still continue to have Halloween. Any questions? If not, we'll wrap her up. See you next week.